Like the Negro have like a wider nose arch or whatever?
Yep, yep, they do. Their nasal shape is different. Vomer bone, like I said, makes up the septum. It's the middle part that separates your nasal cavities. Nasal conch are just little, basically, how do I even want to, scrolls, I don't really like that. But basically inside of your nose, there's a couple little areas that stick out. So inferior are going to be on the bottom. Mandible, this one you do need to know. Mandible, the lower bone, it's the only one that moves, very important. Supports your teeth. The arch and stuff, probably not so important. But the mandible is the only one that moves in your entire face. So here, if I look at these, here is the coronoid process, and here is the mandibular condyle. So it is where your mandible actually joins the rest of your skull, because your mandible is movable. That would be like a joint right there. This picture, out of the skull pictures, I probably like this one the most. This does show most, here the sphenoid, the ethmoid, the lacrimal. You can kind of see where they are. If there is a picture that I would put on the test, that's probably it. It shows the sutures, lambdoid, squamose. It shows the different sutures. That would probably be the picture that I like the most. Bottom, you can look at this. This one will not be on the test. However, foramen magnum, that's where the spinal cord goes. And then here, occipital condyle, that is where your head's going to sit on your vertebrae, or basically where they attach. So occipital, it's part of the occipital bone. Condyle, it sticks out a little bit, so it's an extrusion, and that's where your head is going to sit or meet your vertebrae. Anything else? Styloid is long and skinny. Maybe remember that. Other than that, like I said, this picture will not be on the test. Inside of the skull, you can look at that. Sella turcica. That's where your pituitary gland sits. Make sure that you know that. It's part of the sphenoid bone. And that's probably the most important one on there. Here also inside, here you can see how the cavities or the sinuses are inside of certain bones. So you can see how that works. But there again, inferior nasal conch is going to be at the bottom. There actually is a superior nasal conch, but here we talked about fontanelles. Infant skulls are not completely developed. In order to be born, your skull cannot be hard and completely formed. So after they're born, they have a fontanelle, vocab word you should know, soft spot. So soft spot, typically right in this area, is where incomplete intramembranous ossification. What that means is, remember your skull bones they come down in layers. And those layers are not complete, and they are not completely ossified. They're not completely hard. So those fontanelles allow bone movement for labor, for when the baby's being born, and it allows the brain to grow once the baby is born. And then the sutures fill it in, it does completely ossify, and you never notice it as an adult.
When does it actually get hard?
Oh, how many months would that be? I would say around 6 months, close to that. Amber?
Is there ever any chance that it could ossify while the baby's still in the womb?
I think that is possible. And then the baby would probably have to be born C-section. Also, sometimes it takes longer for that soft spot to develop. But here you can see And this is the one that when I think of a baby's soft spot, that's the one that you're thinking of. There's actually a little smaller one more towards the back of the head. But here you can see the sutures have not come together and those bones have not sutured together yet. And that is the skull and the face and all the parts to it.
Face.